All right, welcome everybody. Got a few more people in the waiting room. We'll wait a couple minutes here, a couple seconds. Okay, welcome everybody. Happy Thursday afternoon to you all, and thanks again for being here for our third in a series of four Q&A sessions with our Deputy Public Health Officer and her team, Dr. Lisa Santora. And we appreciate you being here, and we're going to run through, we'll give you a quick overview of our agenda today. Go ahead and give it to the next slide. So again, welcome public health liaisons. We totally appreciate the work that you are doing and will do to help support our student, staff, and community as we enter a new way of operating our schools in the age of COVID-19, and just want to reiterate, that the role that you play will help us as a community make sure we're doing everything we can to support the safety and well-being of our students and staff. Today's agenda, like in past week's agenda, is we're going to give Dr. Santora an opportunity to go over our current update, give us a little bit of a preview of some of the testing strategies that are running forward for students and staff. I'll give a little snapshot of our current school status, which has changed in an inspiring and dramatic way over the course of the last week. We'll also give a breakdown in not a lot of detail, but just some level of detail about a office exposure, a COVID positive experience that we experienced here at MCOE over the past week and a half, and how we responded to it and what we learned. And then Janelle Campbell is also going to give us a little sneak preview of an incident that we'll break down in more detail next time about how a student positive experience who rides a bus has a multiplier effect of complexity in communications and follow-up. And then the bulk of our time today will be around questions and answers. So you can go to the next slide, Melina. So welcome again, Dr. Santora. We are so appreciative of you and your team and all that you're doing to support this really seems like never-ending process of trying to find a way to get our students back into classroom-based instruction in the safest possible way with active COVID-19 in the community. So we'd like to hand it over to you and get an update.
Well, thank you, Mike, and thank you, of course, to your team. You are amazing, and I just want to give a shout out to my nurses who are on the call. We have Linda Metz, Sandra Rosenblum, and Marcia Grant, who really are the brains behind me. They know our school guidance very well and all of the different scenarios. And when you email COVID-19 schools or call our phone number, you have three amazing nurses that are going to be answering your questions. And sometimes you challenge even us, so be patient with us as we try and navigate some of the different complexities that schools bring to potential exposure. And also shout out to Miss A. She's my school liaison, and I'm thankful to all the public schools teams. I know we work as lean teams, and every school doesn't have a school nurse. And I'm really confident in the public health liaisons, and just want to, I think first, because we want to be 100% available to you, and for you always to know that you're not alone, that you have your phone call or an email or a text away from getting the reassurance you need and the guidance that you need. And we're going to be learning together. And when you see some of the data, I think you're going to feel increasingly reassured of why the steps that we've taken have created safer school environments for us all to be working together to get us back into school and to keep us in school. I can't speak well today. I've been talking too much. So just the update now is that, yes, we still continue to be in tier 2. If you remember that the state gave us a blueprint and created different tiers, a purple tier, tier 1, a red tier, tier 2, and tier 3 is orange. It follows kind of our air quality colors. The good news today is that very different from 2 to 3 weeks ago, when our message was that, yes, we're in tier 2, the red tier, we're much closer to purple. Now we're in tier 2 and we're much closer to orange. Our adjusted case rate is now 4 cases per day per 100,000 residents in Marin County. And to be in the orange tier, you need to have 3.9. So we are right approaching that threshold. We need to demonstrate that we're in the orange tier for 2 weeks though, before we can officially move into the orange tier. And I say that cautiously because I know the nature of us all is that as we loosen up these tiers and there's easing of restrictions, is that the personal behaviors that drive COVID transmission will increase. And so that's where we will be working strongly with parents, especially on encouraging them to continue engaging in the safest behaviors for their families in order to prevent increased COVID-19 transmission for our community. And so there are very defined ways for us to move forward to tier 2. And that really is, how do we decrease the possibility of COVID-19 transmission? That is by making sure that we're not mixing households. You really need to limit your social activity as much as possible. The majority of cases that we'll see in the school environment will not be from school. It'll be from staff who have had interactions at their own households with their own families and friends, and having mixed households get together for gatherings. So that's the first step. The second step is to limit the cohorts that children are in. So the state hasn't given guidance specifically around the number of cohorts children can participate in. The county is. We're recommending that children participate in no more than 2 cohorts. So for my kids in elementary school, that would be their in-classroom instruction and their aftercare. And this is not an order. This is not law, but we are going to be continually reinforcing that it is when you mix cohorts that you increase the risk of potential exposure. Third is all of the face covering that we've seen. I know that there's been concern around the report about airborne transmission. That is not new to us. That is why California led the nation in implementing the order around face coverings. That being said, airborne transmission is not the most common way of getting COVID-19. It's actually, at this point, we still think a very rare event where airborne is responsible. It's when you have a very infectious person who's very symptomatic and coughing, and in a small room, like a hospital room, with staff who may not have been using that N95 mask in that healthcare setting. So there's evidence of this, but it really comes down to what we've known is primarily droplet and contact precautions. So wearing our face covers and washing our hands are going to be the top strategies for preventing ourselves from getting sick. And then just maintaining that physical distance as much as possible. So in the school classroom, having at least 4 feet between desks, and I know some schools are opting for the 6 feet measure. The 4 feet, I often get a question on that, is why 4 feet? The World Health Organization has established 1 meter as the threshold. The 6 feet is an abundance of caution. And so that's why there's always, I know that comes up a lot. And how would we move back to tier 1? It's just doing all the things that I just said. That's us all working together to decrease the prevalence of COVID-19 in our community. And it really, what we are seeing now, if I were to speak to you 2 or 3 weeks ago, I would have told you that more than 80% of our cases in Marin County are among the Latinx community. That is no longer the case. That rate is dropping to now 67%. And that's because we're seeing in our contact tracing more of the voluntary behaviors where people are having gatherings, mixing households, not wearing face masks when they're in a small party in their house. That's when we're starting to see COVID transmission. So we've been successful at our goal. Our goal was to reduce the percent positivity rate in the canal area of San Rafael. It was up to 40%, and now it's less than 10%. So all of our efforts in working together and working in partnership with the city, with the school, with community-based organizations in the canal has helped us achieve our goal. And I think we can jump to the next slide because I think that leads us into the testing conversation. Bingo. So I remembered, I at least looked at it beforehand. So that leads us to a place where we feel much more confident that in the canal area of San Rafael, which was ground zero for COVID-19 transmission in our community, we are seeing the same declines in cases that we're seeing countywide. That being said, we didn't have a high sample size of children and families in the last weeks in the canal. So we are doing a large push for testing in the San Rafael, in partnership with the San Rafael City School District, just to get a solid baseline that's going to hopefully confirm that percent positivity rate that we see now at less than 10% in the canal is truly holding true, which we believe will reassure the the staff and teachers in school districts that have children coming from the canal, that it is that they are safe, and that we don't need to have any discrimination, honestly, between who should come back to school. We want all children in Marin County to come back to school. And we do know that the educational attainment gaps are greatest in communities of color across Marin County, and especially in the Latinx community. And that they, as much as my kids are struggling with virtual education, they are privileged, and there are children and families who are really struggling. And the sooner we can get kids back into school safely, we'll hopefully start closing the educational attainment gap that has been widening since the beginning of this pandemic. And this most notably the TK through second grade students, where we do see the lowest risk. It's the lowest risk population that we have. Just the essentialness of getting, I don't even know if that's a word. It is essential for us to get our youngest kids who really need the social and emotional development opportunities that the school environment provides. Kindergartners are not supposed to be on Zoom, and we're really looking forward to creating that safer environment to get kids back into schools. So that's a thing on the San Rafael testing. We are now in early conversations to work with schools to bring another testing opportunity for school staff. It's very, very early, so I don't want to say more than that, but just to say that your superintendents and the Marin County Office of Education and Marin County Public Health are working together to make sure that essential workers, which include all of you on this call, have access to free confidential testing and more options. Most of you now have access to testing through Kaiser, which is now, if you're a Kaiser member, can schedule testing yourself by going online. Directly. You don't need to talk to your healthcare provider. You should only get tested if you're getting tested as an essential worker once a month. So that's unless you develop symptoms, and then of course get tested. So testing is expanding in our community, and again, access to testing is what's also going to keep schools open. I think that's it on my slide.
Okay, there's one more.
One more.
Sneak
preview.
Oh,
how could I forget this? I was very late on turning in my homework, which was the parent guidebook. And I've been saying this consistently from the beginning. The safety of our schools, parents play such a critical role. We know how parents and even myself behave sometimes on trying to get kids to school, and sometimes medicating them and sending them to school when they may be symptomatic. We've been working hard. You have an amazing group of school nurses that are part of the Marin School Nurses Organization who work to develop a guidebook for parents, so parents can really understand their responsibilities for keeping schools safe. And that means that they're agreeing to limit social activity. They're agreeing that their children are only going to participate in 2 cohorts. If there's someone in the household that's going to under evaluation for COVID-19, that the whole household needs to stay home until we know what's going on, and that they're not sending symptomatic children to school, that children will be tested for COVID-19 or evaluated by a healthcare provider. And we believe that that will, again, start building confidence among school staff that they're not seeing, there will be kids with sniffles, but you'll know that they have been evaluated by a healthcare provider, or it's been confirmed to be allergy symptoms. And so we are being very conservative in our approach, erring on the side of caution, because again, we want to take this time as we have the lowest prevalence of COVID-19 in our community since probably June. I just looked at data. We only have 4 people in our hospital right now. We had a peak in July of almost 40 residents in the hospital for COVID-19. Now we're at 4. And the last time we saw that number was in early June. So this is a great opportunity for us to be very conservative in our approach. As always, COVID-19 changes things, so I'm sure that will change in the future. But our current recommendation is a very conservative approach towards how children can go to school if they're having symptoms, and that for the majority of kids, it will require COVID-19 testing if they are symptomatic with anything that looks like a URI. Again, that will probably change as we move forward. Sorry. In this pandemic, but we're working with your pediatricians and family physicians to make sure that they can get kids tested. And this, again, making sure kids with limited resources and limited access to healthcare also have the same access to testing so we can get them back into school as quick as possible. So we have great partners in the community like Marin Community Clinics that are challenging us to make sure that they get access to testing resources so kids who don't have COVID-19 can get back into school as long as they've been improving symptoms and been fever-free without any fever-reducing medicine for 24 hours, which we know that some parents, and it was just described to me this week, dope was the word that came in my mouth, but that medicate their children with Tylenol or Motrin before sending them to school. We're very much discouraging that practice. And so, lastly, because of our awesome partners at MCOE, we'll be, once we release the handbook, we'll be offering a training for parents that will be recorded. And then we'll find more creative outreach strategies to parents for them to understand their responsibilities in creating that safer school environment. Right, I think I said enough now.
All right, thank you, Lisa. And so yeah, as soon as we get the handbook finalized and translated, hopefully early next week, we're looking at possibly doing a parent and community presentation. We're tentatively targeting next Thursday evening. We're going to finalize it, and it'll be like a 5 o'clock in the evening presentation that will also be taped, just to kind of overview the amazing student and family handbook that you guys have been working on. And this is just a slide that has the public health school's email address for public health liaisons, and you will also get the backdoor phone number for weekday and weekend emergency contact information. And you know what? I can tell one of the signs for me that I've been hanging around the public health team is when Lisa said URI, I knew that was an upper respiratory infection. So I'm feeling like I'm kind of starting to understand that a little bit. Okay, so you can go ahead to the next slide, Melina. So, quick update on what's happening in our schools right now. As everyone knows, this was a big week for our schools, and many of our public school districts did kind of the slow start to site-based classroom instruction. So as of right now, we have 10 school districts in the county. That includes 24 school sites and at least 29 private, independent, and parochial schools that are currently offering site-based instruction. Over 110, it's probably closer to 130 where of the school site specific protection plans have been submitted for public health review. And we can't tell you, Linda, Sandra, Marcia, the whole team there, how much we appreciate the time that you're taking to go through those, give us feedback and input. And those are the templates for how our schools will ultimately implement the guidelines at the different school sites. Right now, today, we have over 5,600 kids and over 400 cohorts now participating in site-based classroom instruction. That doesn't even include we have about 35 student learning hubs that are up and running with about 400 students. So, that's a great step in the right direction. So at this point, there's a little over, and I appreciate all of the, we've been trying to gather data for ourselves and for public health about how many students are on site every day. So thanks to all those of you who've responded to surveys and phone calls. And there's been some data that we've pulled just from the publicly available information on the websites and the IJ articles. But we have about 28,000 student days and over 2,000 cohort days per week currently active, which is awesome. And over 60,000 student days and over 5,000 cohort days since September. So that's a lot of activity. That's a lot of kids in the classroom, in cohorts, learning in person. And we appreciate everything that everyone has done to help make that possible. The next slide. So this is the cumulative data that has been compiled from March 19th, which was the opening day of our first pop-up childcare programs, when we opened, I think, 3 cohorts with 11 kids. And started to develop this cohort model and the health and safety practices that have evolved and been tightened up. And so, this is the data, almost 70,000 student days now, 6,489 cohort days. There have been a total of 3 cohorts closed due to COVID-19 exposure, with an average number of days of closure of 8. So it's less than 1% of the cohort days have been closed due to COVID exposure. And you can see the data. That's a total of 4 students who've tested positive. There was 1 suspected and then 1 staff member who tested positive, and there was 1 suspected student-to-student transmission. But that is our data. We're going to try to keep this as up to date as we can. So as schools and districts begin to open, please, help us gather the data we need to help keep this information current. So Lisa, is there anything else you want to say about that slide? Okay.
No, I just want to say congratulations. I think this slide shows that when we follow the school site specific protection plans, can successfully prevent an outbreak and contain COVID-19 when it does, prevent COVID-19 transmission when it does enter the school environment. And I think everyone should be proud of this work. It's a lot of people learning a lot of new competencies in public health, but we can do this together. So thank you.
Yeah, and I guess what also is clear is that the reason that we've been this successful, there will be COVID positives in our community. COVID is active in our community, and there will be situations of COVID positive students and staff. But essentially, the way that we are setting up the protocols with public health is that we're acting as if every person is an asymptomatic carrier. And we're, as soon as symptoms come up, people are staying at home, and we're getting them monitored and tested. And so that's the goal continuing forward, is if you're going to get it, our goal is that you're not going to get it at school. You're going to get it out in other parts of your life. And so we'll continue to focus on that as our goal. So, the role of the public health liaison, we've shown this slide for the last, few sessions, and including the trainings, and again, contacting public health. And this is something that I put in red and bold, I added this week, is for known or potential COVID exposure. So we know that throughout any given day at a school site, there's a dozen questions that come up that you'd love to get public health's input on. And our COVID schools team is really focused on doing the COVID exposure contact tracing. So we don't want to bother them with the question of, hey, if we're using a basketball with one cohort, do we need to clean it before the next cohort uses it? Send those types of questions or other logistical questions to rapid response, and we'll do our best to interpret the guidelines as we understand them. And if there's something really significant that we need public health input on, we'll forward that. Knowing the protocols, quickly accessing the critical data that public health needs, and then initiating appropriate school communications. We've erred on the side of over communicating, and we probably will continue to do that. We want to make sure we're getting information out. There's now, legislation, that is in place that requires a certain level of communication. But our goal is, whenever there's a known or potential exposure, we're letting staff, families, parents know, whether it requires any specific action. It's just awareness. So we're doing our best. And I'm going to just mention again that the 2 trainings that we did in August and September for the public health liaison are, the videos are available on our website. Okay, you can go to the next slide. So this is just, again, the document that each one of you public health liaisons should study, should understand, should know, should ask questions about, should help bring forward any contradictions, should make sure that we're updating if things change. This is what I know Janelle and our team has really relied on whenever we've had a known or potential exposure. Next slide. So, and then the plans, as the public health liaison, you should be very, very familiar with the plans. You should be an active member of your school's disciplinary task force and ensure that that task force is communicating, meeting on a regular basis, getting feedback and input, getting questions that you don't know the answer to, and helping figure out what the proper response will be, and connect with us. We'll do everything we can to support you in that role. Next slide. So, we had a real-time COVID positive at the MCOE office. We've been fully staffed in our office since June 1st. We have about 70 or 75 people who are in here every day, and we had about maybe 10 days ago now, we had our first COVID positive experience, and it's intense when you get the email that says confirmed COVID positive. Your heart starts racing, and you want to do everything right as quickly as possible. And so we have on our team, we've identified 2 staff members who are our public health liaisons. We pulled them in. We discussed what we knew. An office setting is different than a school setting because we don't have established cohorts, and we are truly behaving in a way that we all do are COVID positive asymptomatic. So we're really good at reminding each other to wear face coverings. We're washing our hands. We're following all of our protocols in the office, and we discussed, could this individual have had any close contact with anyone in this office? And the consensus was, well, no, because of all the things that we're doing. It would not happen unless it was outside of the office setting. But let's talk about who has this person regularly interacted with, been in meetings with, even if they're distanced with face coverings on. Let's err on the side of caution. And we identified about 5 or 6 people in the area that even though they didn't meet the public health definition of close contact, we said, hey, just to be safe, why don't you go work from home and get tested? And that's what we did. And fortunately, they all came back. The tests all came back negative. It took a few days. And our colleague who tested positive has been asymptomatic now for 5 days, and they're doing well and will be returning next week. But we took the school setting office checklist, and we made a district office version of it that is now available on our website. There was within an hour there was a communication to the whole team, staff members, throughout 75 people in our building got the message, and it leads to other questions about, okay, how are people behaving outside the office? Where could they have been exposed? And it was unknown. It was uncertain. Maybe at the grocery store, but that's the brief overview. And just to know it's going to happen, and the practices that you have in your office setting are critical, just as they are in the school setting. So what I would say is that as schools begin to return to site-based classroom instruction, our first step here is, before we could even have that conversation, we needed to make sure our district office was role modeling that. And it took a few weeks, but over about a 3 or 4 week period, we went from about maybe 10 or 15% of our staff working on site to 100%. And I will say that it's a hard for some people, it's a hard transition to make from working remotely at home. You don't have to commute. You can wake up, have a cup of coffee, and go to work, to to coming back in, and the uncertainties and the unknowns. But we view it as a really, really critical first step. So for those of you who work in school offices or district offices that are not 100% on site, we recommend that you get that up and running as soon as possible, so that when students are returning in mass, that you're role modeling that that you can work safely on site and using your protocols. So I'm going to go to the next. Oh, and then Janelle is going to go back one slide, Melina. Janelle is going to give us just a sneak preview of next week's episode of Public Health Liaison Training.
Woo!
Yeah, so we'll give you just a quick snapshot of something that just came up this week, another real life scenario, situation where there was a positive case identified in one classroom that resulted in the closure of that classroom, that quarantine period, and that student was transported on one of our school buses. And so as a result, we learned that very quickly that we're all really interconnected. So this particular positive case was not at a school or program operated by MCOE, and yet we had students that are served by MCOE that either ride the same bus with a student that was in that cohort or were transported by a bus on a separate route that the student who was positive rode on that same bus with the same driver. So as a result of all of that, there were a lot of impacts and communications, and we really learned the importance of making sure we have really factual information. We're communicating with each other, thinking about who else could possibly be connected, that we need to make sure we're communicating back with our public health nurse to make sure that they have all of that information. So next week we'll unpack that a little bit more since it was really an important learning lesson for us.
That's great, Janelle, and we look forward to that. We're also meeting with the school transportation providers next week to kind of debrief the incident a little bit and how we can most effectively work with school transportation providers and public health to get public health the information that they need. And, you know, so we look forward to that next episode. It's going to be exciting. Lisa, Dr. Santora said this will be like a case study of contact tracing when there's all these overlapping, interconnected bubbles and circles of people. So we look forward to further debrief on that. One of the questions that I just see popped up in the chat box for contact tracing, what is our responsibility for office staff, was what one of the questions was. Lisa, can you address that?
So for office staff, from our public health perspective, is that we will be working with you as an employer in the sense that we want to understand which other staff folks may have had those have had close contact with the individual who's tested positive. What we have found in most employer settings, and I'll let Sandra jump in because she is our expert, is that it's almost best to inform everybody that there's a positive case in general. It just keeps everyone reassured. We generally identify just the true close contacts, and then public health will recommend testing for the true close contacts. But we also understand that some people will need testing for reassurance. And right now with the current availability of testing, it is not a problem for staff who really don't meet the definition of close contact to get tested. But what we would recommend, and this is one of the biggest challenges, is when people get tested. It's what we see commonly is people like, I've been exposed, I need to be tested right away. That doesn't work. You're going to get a false negative test. You really need to wait at least 5 days to get your test after the last day you've had a known exposure. And that is because it takes time for your body to develop the viral load, that's what we call it, that there's replication of virus sufficient to be detected by any of our tests. But the nature of staff is not, it's across the county. It's like, oh, I've been exposed, I need to get tested. No, you need to wait, you need to quarantine. If you are true, and this is the difference, and I'm going to shut up soon, but the difference that we see is with close contacts, they're going to need to quarantine for 14 days after their last known exposure. With people that get tested for reassurance that are not, and those individuals, even if they test negative, cannot return to work. Even if they test negative on day 7, they need to complete their quarantine because it's still, we're still treating this disease very, very conservatively. Even though most people will develop an infection within the 5 to 7 days, there's that 14 days, which is that biggest window that covers 99+% of people. So we're still using the 99% window rather than the 85% window, which is that 5 to 7 days. So we're really erring on the side of caution. Those individuals that get tested just out of reassuring themselves and they're not identified as close contact, we would say come back with a negative test. We would say they don't even need to go home and quarantine if they are not identified as a close contact, but to monitor for symptoms. So now I'm going to shut up and let Sandra correct me.
That was exactly it.
Okay.
That was exactly it.
Yeah, and so what I just want to say in response, so there are times I know that I feel like Janelle is kind of a para contact tracer. I mean, she's like a person who has, because of her role in our organization, has become a kind of an expert at gathering the facts. But we want to assure our public health liaisons at the schools that you are not contact tracers. You are gatherers of fact. And so what public health wants is they want the facts. Here's what we know. This person started feeling symptoms here. They were tested here. They were sent home. What are the facts? And then they will determine who's a close contact and they will conduct that. So be assured that you are not contact tracers, although you'll feel like one. And so our response in the office, and there was a question here there was a curiosity about how we discovered it was a positive case. The person had some symptoms, had some mild symptoms, first kind of fatigue and then a fever. They decided to get tested. They called in and said, I've got fatigue and a fever, I'm going to get tested. And then a couple days later, they found out that they were positive. So that was the way it came about. It was not through surveillance testing. But what we did is, we sent our public health team, the 5 or 6 people that worked in closest proximity to this person, just in case they wanted to follow up, and it ended up that, the person, because they were out of county, their county public health took on the contact tracing, but there wasn't any close contacts here. So that's just a quick overview. You're not a contact tracer. Okay, so I'm having a little challenges with the chat box here. So Melina or Ken, if either of you see, so some of the questions that are coming in are not specific to public health, to public health liaisons, but we'll get to as many of it as we can. Okay, so our district is beginning to bring some students back, but it's not fully opening until November 30th. Should the county go back to purple before we fully open, hopefully an unlikely scenario, is there a certain percentage of students on campus that would constitute us as being open before then? Does that make sense? So this is a question of, if we go back to a more restrictive tier and the school hasn't opened, do they have to have a waiver? Can they continue to operate at their same level?
They can continue to operate at their same level. So you can continue to follow your site-specific protection plan. So that would be this might be an opportunity as everyone comes up for, I guess you're not coming up for air because school's starting, so you're more busy probably than you've been, but just to make sure that you're implementing the site-specific protection plan, that it's in place. And then if we were to return to purple, if you've already been operating, you can continue operating according to that plan.
So there's a question also about recommendations for parent-teacher conferences. Can they be on site and outdoors if wearing masks and physically distant?
That's a good question. At this point, I would only recommend it if there's some exception that would really require an in-person conference. So for example, I think with my kids, there's not behavioral issues, there's not emotional issues, there's not academic issues that I think I think a Zoom would be the preferred option. That being said, if there's tougher conversations that really, because sometimes for tougher conversations or more critical conversations, the in-person meeting really is what is needed, then that definitely would be allowable by public health. But I would think for the majority of parent-teacher conferences should, if possible, be still virtual. You're just decreasing those exposures. And then 2, absolutely allowable, especially if there's critical conversations that that a teacher deems would benefit from having an in-person conversation. Still be in a classroom, it doesn't need to be outside. Just maintaining that 6 feet distance would be more than sufficient with everyone wearing face coverings.
Thank you, Lisa. So in this, I assume that this question will be addressed to some degree in the upcoming student and family handbook, but are we requiring a doctor's note or test results for students to return to school after being out sick?
Yes.
Yes. So this is going to be a tough one. So we've identified, we're using the same CDC symptom list. So for the majority of symptoms on the CDC symptom list, they will require a COVID test to return to school, a COVID negative test to return to school. Sorry, a negative COVID test to return to school. If they are unable to get a negative COVID test, or if they're unable to get tested, then they need to isolate at home for 10 days. We're going to treat it, our fancy medical language is as a presumptive positive. So we're going to treat it as positive for 10 days. We're meeting with the nurses because this creates some complexity, because if there's other siblings, then the sibling of that presumptive positive would need to be on quarantine. And so we're trying to find the language to help parents understand that you could have one child who would return to school after 10 days because they were unable to get tested, and another child who's living in the same household might have to stay out for 14 days. And so we're really going to try and drive individuals for the majority of symptoms to get tested. There's 4 exceptions. Headache's a great example, where a child can present with a headache, be seen by a doctor and offered an alternate diagnosis like a migraine, or a sore throat. They would be offered an alternate diagnosis. A child known to have a history of strep throat just gets tested for strep, offered an alternate diagnosis, and they can return to school if they're fever-free without fever-reducing medications for 24 hours. And then the third cluster of exceptions is there's 3 symptoms that are considered less common symptoms. That they're the runny nose, achiness, and fatigue. They still need to be seen by a doctor. The doctor will discern whether they need to be tested for COVID-19 or not. This is going to drive a significant amount of COVID-19 testing. We appreciate that. The good news is that color testing now, your healthcare providers across the county can refer children to color for COVID-19 testing. And and it's still under development, but the county is getting the credit card test you may have heard of. And I just completed a prioritization meeting where we're trying to, with the a limited amount of antigen tests that is coming into the county, how are we going to prioritize that testing? Facilities with older adults are obviously a priority, and getting kids back into school is our 2 priorities. So that's still under development. We don't have any of those antigen/credit card tests in the county yet. But again, a priority for us, especially from an equity lens, is making sure that kids have access to testing so they're not missing any additional school. We really feel that this is necessary. Again, this is a very, very conservative approach. We feel at this phase in the pandemic in Marin County, in order to build the confidence and comfort for staff and teachers to be back in school, and testing and a doctor's note is where we need to be right now. Again, when we shift, let's say, into the yellow tier, we might be changing our guidance. You always need to be prepared for changes in guidance from public health. But at the launch of schools, we want to keep the record we have of almost 70,000 student days and only 1 suspect student transmission. And we think this is the way at the beginning of the school year to move. Sorry, another long-winded answer.
Okay, so this is kind of a little mini tabletop question, but it's the sort of thing that I would imagine if I was in this situation as a public health liaison, I would contact our COVID-19 schools team, just get some input, and they would provide some specific direction. It may also be in the handbook, but so if a custodian at a school site has a COVID positive family member, they are sent home to quarantine for 14 days. If the custodian has been in close contact with other custodial staff, do the other custodians need to go home and quarantine for 14 days?
Want to answer that, Sandra? I have my answer.
Yeah, well, we'll see if they match. The custodian with the positive household contact is quarantined. If they are not able to separate from the person who's positive, like if it's a young child or something like that, it may be more than 14 days. Their quarantine may not be able to start until the other person completes their isolation. If it's like an adult child or something like that, or another adult household member, then they can probably easily isolate from each other and start the quarantine process right away. So that's thing number one. The other contacts at school, close or not, are contacts of contacts. And so we would notify them that somebody, kind of as if, like when someone in the cohort has a positive contact, the rest of the cohort gets notified, but the cohort is not closed. And I think the same would be true for a group of custodians or office workers. They're notified that someone that they may have been in contact with was in contact with a person, and then they can get tested if they want.
Was that your same answer, Lisa?
It was my same answer. We
All
agree.
right.
Me too. Me too.
It's like
Wow.
a game
Okay.
show here.
Okay. So we've
We've
got a question.
triangulated, so it's
I know.
confirmed. It's still
Okay.
fact.
So we've got a question on the high school sports. Do high school students who are participating in indoor sports under school authority, are they required to wear face coverings? Indoor sports.
Yes.
Yes. Okay. Got that, Mike?
And this is, we're developing guidance around sports. Our biggest concern right now, our biggest concern right now is there's students that participate outside in sport competition outside of the state of California that is not following the same California requirements. So sports right now in California is not competitive play. It is only strength and conditioning and maintaining 6 feet distance, although I know and heard that is very challenging regardless of age. And so that being said, we're gonna be looking at, we've removed the travel criteria for quarantine, but if a student goes out and plays in a competitive sport in competition out of the state of California, we are now evaluating whether that student needs the quarantine. That is one, or students, that is one of our worst case scenarios, especially in the high school level, is that students are following all the guidance of California, which was much more strict. They go to another state as a team. So I've heard of one scenario was 12 kids that went out of state. They were coming back to school. And so we want to make sure that those students are not introducing COVID-19 into the school community. We haven't developed the guidance yet, but I just wanted to put on people's brains that we're thinking of these second, third generation exposures and trying to think of the whole landscape. Again, everything that we can do to reduce the risk of COVID-19 entering into the school community. So it's complex.
Does that answer your question, Mike?
Yes, thank you so much.
Yeah.
Appreciate it.
So this is kind of a continuation of the scenario, kind of mini tabletop. So if a student comes in close contact with someone who is tested positive for COVID-19, do they stay home for 14 days and we need a negative test result for them? If so, what is the timing, both the 14 days and what is the timing on both the 14 days and the test date?
Go, Sandra.
If they come into contact with someone who tested positive for COVID, they are quarantined for 14 days from their last exposure to that person. During that time, they can get tested, and we do encourage them to get tested 5 to 7 days after their last exposure. But they're still quarantined for the 14-day period because they could still be incubating the virus. If they don't get tested in the 14 days, they can still come back at the end because they've completed their quarantine.
And this is where we are really going to be encouraging parents to get the child tested in the 5 to 7 day range so we can have definitive information for the cohorts and determine whether we determine any infectious period. So we really are strongly recommending, we're not ordering, but we're strongly recommending testing 5 to 7 days after the last known exposure, just so we can have the full information and picture to inform any additional public health action at the school level.
So this is a question just about how to compare Marin County to other places around the country. What is the best metric to use to compare places around the country to Marin County, since states use different metrics? Is it positivity rate or another metric?
I think the best rate is the case rate. There might be variability in states around whether they are doing cases per day. It's always per 100,000, but it might be cases per week, cases per day. We also add in, we get fancy and add in lag time because it takes time for test results to happen. So it really is the case rate, and that will become increasingly so, especially as those credit card or antigen testing is available. We call it point of care testing. It's not going to be our percent positivity rate. We're not going to have, it's becoming increasingly less accurate because people can complete the antigen test, but they aren't required to report what we call the denominator. The denominator are all the tests, the positives and the negative tests. So when you have those point of care tests, they're not reporting to us the negative results. So it'll become, we call it unstable. That percent positivity will become increasingly unstable. So the case rate is the most consistent rate that would be equally applied into other communities. And the best way, Dr. Willis was actually describing it, and I think it's a great way to understand Marin County. We're probably a county that's mostly yellow, that has had if you look at all the census tracts in our county, we probably are a mostly yellow county with that has had outbreak areas that have kept us in the purple, which has led us into this place. We're in this red-orange zone. All census tracts in Marin County are not equal because of structural racism, income inequality, low wages. Depending on your zip code not only makes a difference, but also your census tract makes a big difference. And so our outbreaks have really been in those census tracts that have more crowded living conditions and lower income. So if you were to look at the state, and we're going to see if we can work on something like this, but if you were to look at the state as this counties, you see this kind of different colored pattern. If you were to break down the census tracts in Marin County, you would see also a very different colored pattern of both case rate and percent positivity.
So there's a couple more questions, that are more kind of logistics, like, okay, so do children in a PE class outside have to wear masks? There was also a question I saw about music, any particular direction on music class. I don't think we have specific guidelines for that.
We're developing guidance for music. Music is a high risk activity. I might have mentioned this already. We had a TB outbreak that was driven by choir and band performance, especially woodwind or blowing trumpets or blowing respiratory droplets. When we're singing, we're projecting respiratory droplets. So they are definitely our higher risk activities. We'll be working just like with sports. We're working with the Marin athletic trainers. We're working with physician music. You have a bunch of great parent doctors who are volunteers at your schools are really trying to create a safer environment for all the extracurricular activities. So there's also a music booster group that we're working with to try and develop guidance that will, just like our parent handbook, will be reviewed and approved by Dr. Willis. And again, also just with extracurricular activities. We know our first goal is just get kids back in for in-person instruction, but we know behind that, also a critical part of their social and emotional development is their participation in sports, music, and other service groups. So we're going to try and pivot to that focus as we move forward. And I won't give you a timeline for giving you that guidance because Lenora will tell you it'll be much later than when you want it.
So I'm sorry, did you address the PE class? Do you have to wear a mask outside when you're doing a PE class?
If they can maintain, so it depends on the teacher and the kids, I'd say. If they can really maintain 6 feet distance outside, it would probably be a great time for kids to have a mask break. I think schools really should be thinking about the face covering break. It'll help reinforce being in the classroom and wearing the face coverings, and then just understanding that it's harder for kids, especially those younger kids it's harder for me. I love being in my own office. So I don't have to wear the face covering.
So, and there's one here, and I will give my answer. Is it okay for a parent art docents to come on campus to collect art supplies to be distributed to students? And this comes in the area of non-essential visitors, and we've become pretty strong advocates of really not having non-essential people on site. So, I mean, am I being too hard on that, or like, we're trying to limit the number of people who are on site?
I think in the beginning, you really do need to limit the number of people on site, but then you also can create safe, like, I think like, preparing the weekly folders. Like there's some activities that parents were engaged in, and that might be something after the school staff gets their kind of feet wet and builds confidence and competence in the school safety plan, bringing a parent volunteer who's trusted, who is following the guidance around face covering to prepare packages and stuff like that, I think would be allowable. But again, the more people you bring on the campus, the less control you have, less awareness you have on that. So I would still keep it a very controlled process of knowing exactly who's on campus when, because we need to know that if there was to be a contact tracing. So I think it's important to be strict in the beginning until you build your confidence on managing additional visitors, but we also would recommend very much keeping it only essential visitors at this time.
Yeah, and there's also someone's commenting that there's some MOUs with districts that say kids have to wear masks at all times, and you probably need to follow the MOU,
Yeah.
even if there's a public health, advice that, if you're outside in distance, that it may be a time to take it off. So you probably will need to go with the MOU unless you can renegotiate that. So and this will be the final question about any progress on mandatory testing for faculty or staff at schools.
We right now are focused on enhancing availability of testing in order to avoid a necessary order for mandatory testing. We think with the new testing, it is no longer the deep nasopharyngeal testing that many people were avoiding. The testing specimen collection process is a lot easier. And so we're hoping by increasing accessibility, availability, and it not being such an invasive, it doesn't qualify as a true invasive procedure, but for many people it felt, the nasopharyngeal swab felt invasive, and I've heard that as a reason that people don't want to repeat testing. We're hoping that those three strategies will allow us to avoid any mandate or order for monthly testing. Again, the staff need to follow the same guidance. Staff who have someone at home with COVID-19 symptoms need to stay at home until that person gets tested. Staff who have known exposure to COVID-19 also need to stay at home and quarantine, and staff who are symptomatic themselves need to get tested or see a healthcare provider before returning to work. So it's the same rules apply. And again, we are most likely to see staff to staff transmission than any of the other transmission patterns, and it's most likely not going to be necessary in the first weeks of return to school. It's going to be when we get more lax in our group behaviors, our snack times, break times, etc. So,
okay, you
I'm
guys.
hoping for no mandate, but I will not promise. I mean, that's something we try first with voluntary compliance, and then there's been times, if you can go to our website and see all the orders that have been generated, those orders are generated when we can't get voluntary compliance. So like the flu shot, that's a great note to end on. We have a mandatory order for flu shot, not for school teachers. There's no mandate that school teachers are required to get a flu shot, but we have mandated, and this is the strictest mandate that I think is in the state of California, is that all workers, all staff at all healthcare facilities, it used to only be healthcare workers, but staff at all healthcare facilities and staff at all residential care facilities for the elderly and skilled nursing facilities must get their flu vaccine this year. This is the one tool that we have. It's a safe and effective tool to prevent disease. And we are potentially going to be entering into a second wave and a flu season at the same time. So you can get your flu shot now. Most of you are probably Kaiser members. You can just drive right up. There's never a line. There's no bad day to get a flu shot. Get your flu shot. It's not mandated for you, but for others in the community, it is.
Okay, thank you so much, Dr. Santora, Sandra, Marcia. Linda, the whole public health team, we can't tell you how much we appreciate you guys and your partnership and support through this. There's some great, compliments and thanks in the chat box. The last thing I'll just say, there's a question, testing once every 2 months or every month. The guidelines say at least every 2 months. If you can get it more, I'd say great. Don't forget to tune in next week at the same time for an exciting overview of the student bus COVID positive story and further questions and answers. And you guys, thanks again for being here, for the work that you're doing, and we'll look forward to seeing you next week. Bye, everyone.
Bye.